consideration at second reading of Bill C-293, Pandemic Prevention Preparedness Act, standing in the name of Mr. Erskine-Smith.
I acknowledge the honourable member for Beaches, East York.
Thanks, Mr. Speaker. As of today, addressing this House, we've lost over 45,000 Canadians to COVID, and there are millions of people around the world who have died as a result of COVID. It has upended our lives in so many different ways, from isolation to school closures, upending businesses and major economic disruption, reverberations that we still feel with difficult inflation and interest rates hikes that are challenging many households. The global impact on poverty rates, the upending of education around the world will have long-lasting and negative effects. And then the increase in debt that governments around the world rightly took on to address this crisis in many respects, but both public and private debt in both cases also come with consequences. 57% of Canadians whose debt increased attributed that increase to COVID. As a parliamentary intern in my office, Alith, put it, even having just lived it firsthand, it's hard to wrap our heads around what we just experienced. Now, what can and should we do about all that? What lessons should we learn? Well, I think we have to be specific and clear and put a framework in place to make sure we don't lose these lessons. And simply put, Mr. Speaker, the message of this bill is that we need to learn the lessons from this pandemic in order to prevent and prepare for the next one. No, we aren't done with COVID, but we've also lived through enough to learn from our pandemic response across all levels of government, and those lessons should inform our plans going forward. So what does the Pandemic Prevention and Preparedness Act do? It does three things. First, it establishes a review of our COVID response, not just from the federal government's perspective, but across all levels of government. And the goal is to be comprehensive. And so just to comment briefly on the scope of the review, the bill notes, in conducting its review, the committee is, among other things, to assess the capability of the Public Health Agency of Canada and Department of Health to respond to the COVID pandemic before and during the pandemic, in collaboration with provincial and municipal governments to assess the public health and pandemic response capabilities of those governments, certainly to assess the effectiveness of the exercise of powers within federal jurisdiction, and importantly, and this is the broad element to bring to bear on lessons learned, to analyze the health, economic, and social factors relevant to the impact of the pandemic in Canada. So there's got to be a review if we're going to learn the lessons of our government's response and the response of all governments. Second, how do we take those lessons and put them into a framework where we're going to see accountability, transparency, and action on a going forward basis? So the second thing that the bill does is it requires the Minister of Health to establish a pandemic prevention and preparedness plan, and modeled on climate accountability legislation, legislation that, to my knowledge, the first piece of climate accountability legislation that I reviewed was a Conservative government in the UK in 2006, and we now have such a framework in place here in Canada. But this takes a similar approach to say there's got to be a transparent and accountable framework by which a government is obligated to table a plan to Parliament, to the Canadian public, and then update that plan on a regular basis. The bill, by the way, suggests every 3 years, but I went back and forth between 3 and 5 years. I think 5 years would be appropriate as well. And obligates the Minister of Health to establish a pandemic prevention and preparedness plan and to table that report. And the bill sets out a long list of factors, and this is where it was quite difficult, actually, Mr. Speaker, because I was drawing from a great amount of expertise out there, from the United Nations Environment Programme's report on preventing future pandemics, from IPPA's, the Intergovernmental Science Policy Platform on Biodiversity and Ecosystem Services, and their workshop reports in relation to pandemic risk and how we prevent future pandemics, and certainly from the independent panel, which has a series of reports now on preparedness and response at the national level and also at the global level, and how we can strengthen those responses at all levels, frankly. And so taking those expert reports and taking in consultation with some of the researchers behind those reports, and certainly with Canadian health experts as well, the bill sets out a series of factors that the Minister of Health must consider in developing a plan. And they are, I'm sure I missed some elements, Mr. Speaker, and that's partly why it's so important to get a bill like this to committee. The committee, I hope in a nonpartisan way, can say, this doesn't make sense, you missed something here, Nate, and this is how we can get it to the best place possible as a matter of what should be in and what should be out of a plan as the health minister considers it. But as a starting point, and I think obvious enough, what should the health minister do? Identify the key drivers of pandemic risk and describe how Canadian activities, domestic and abroad, contribute to that risk. Because we focus a lot in this House and frankly in the Canadian public around preparedness strategies, and that's part of what this bill does as well. We don't talk enough about prevention, but we know that the costs of prevention are a small fraction of the human and economic costs, the significant human and economic costs of living through a pandemic. So one, there's got to be a real strong focus on prevention. There also has to be a commitment to ensure collaboration at all levels of government, because it's not enough for, in our federation, the federal government to take action on its own. Similar to climate action, certainly with respect to mitigating pandemic risk and to preparing for pandemics, it can't all be on the federal government. And we've learned that. That's unquestionably a lesson that we've learned in the course of the response to COVID. So the bill requires the Minister of Health to ensure sustained collaboration between the Minister of Health and provincial governments and Indigenous communities in the development of the plan in order to align approaches and address any jurisdictional challenges. Now, I probably could have been a little clearer, but the language here also provides for training programs, including collaborative activities with other levels of government. What I had in mind there, though, and I think a committee could improve this, what I had in mind there is simulation and table-topping exercises. It's not enough to have a piece of paper with a plan written down. You got to put that plan into action and learn where there are gaps in that plan and where jurisdictional challenges arise that can be addressed through a simulation exercise rather than as we live through a real-life pandemic. Now, there also have to be, and this is a critical element here when you draw from the literature, the plan has to be based on a One Health approach. And for those who don't know what a One Health approach is, it's a relatively simple idea, although it can be a challenge sometimes in how we apply it because of how holistic it is. But it's this idea that you can't pull apart human health, animal health, and environmental health, that these are interconnected ideas and we have to think of them as one health. And we know this, and if you read the literature, Mr. Speaker, from the United Nations Environment Program or from IPBES or from any number of experts, including Canadian experts in zoonotic diseases, they will tell you that zoonoses present the greatest risk in relation to pandemics, and the spillover risk of, let's take deforestation as an example, the spillover risks that can occur when humans are obviously going to come into closer contact with animals as a result of that deforestation creates not only a challenge to the environment, it's a question of environmental health, deforestation, it's also then a question of human health because of that spillover risk. And you run down the list of factors and there are different reports on this, but overwhelmingly the focus has to be on a One Health approach. Let me read, I've got notes everywhere, Mr. Speaker, but I want to read a particular quote from the United Nations Environment Program. They note, "This report confirms and builds on the conclusions of the FAO, OIE, WHO, Tripartite Alliance, and many other expert groups that a One Health approach is the optimal method for preventing as well as responding to zoonotic disease outbreaks and pandemics." So, there's got to be a focus on a One Health approach. There also, of course, has to be a whole of government approach. So it's not enough for the Minister of Health to work up a plan. The Minister of Health has to work with other ministers and break down silos in the federal government to ensure that we are putting ourselves on the best footing we possibly can be to prevent and respond to future pandemics. And so the Minister of Industry has a role to play in terms of ensuring that we have vaccine manufacturing capacity and manufacturing capacity for essential treatments and tests. There's a role for the Minister of Public Safety and the Minister of Transport to play with respect to border controls. There's obviously a role for the Minister of Global Affairs to play with respect to global health equity, an issue that unfortunately we have, I think, as wealthier countries utterly failed on in a serious way in the course of this pandemic. There also ought to be collaboration, and this is in keeping with that idea of a One Health approach. There has to be collaboration with the Minister of Agriculture and the Minister of Environment. So if we think of a framework that already exists within the Government of Canada, a One Health approach with respect to antimicrobial resistance, that is a partnership as between the Minister of Health, the Department of Health, and the Minister and Department of Agriculture. Because we know, again, that the overuse in some cases, certainly in other countries around the world, that the increase and overuse of antibiotics can create the risk of superbugs and create, there are researchers at McMaster that will call it the silent pandemic in terms of the number of lives that are already being taken by AMR. So, a whole of government approach. Now, I will say, and this has to be a focus of the committee when they look at the series of factors, ensuring that, and this gets to the sustained collaboration with provinces, because we need to make sure, for example, that there are preparedness strategies for public health services, including the protection of vulnerable and marginalized populations. Now, that will be as much a provincial question as it is a federal question. Working conditions of essential workers across all sectors. That will be as much a provincial issue as it is a federal issue. The availability and management of relevant stockpiles, including testing equipment and PPE. That is certainly more of a federal issue, but we've seen challenges at times at the provincial level as well. The surge capacity of human resources required for testing and contact tracing, because you can't have the human resources at the ready at all times. You need to be able to stand them up to meet the surge. And again, this is provinces and the federal government that will need to work hand in hand. Now, there are a series of other factors, and I won't go into all of them. I do want to mention the 7 key disease drivers identified by the United Nations Environment Program. So one is an increasing demand for animal protein, because again, we understand spillover risk, a lack of biosecurity, especially with increased demand in low and middle income countries. It is a real challenge that needs to be addressed. Unsustainable agricultural intensification, increased use and exploitation of wildlife. If you look at live animal markets around the world, they have presented challenges, including likely in the course of the crisis that we've lived through. Unsustainable utilization of natural resources accelerated by urbanization and land use change. Travel and transportation. Changes in food supply chains, traceability challenges are the issue there. And then climate change. These are major twin risks that climate change is an existential risk in and of itself, but it also drives pandemic risk. And it's not to say we can eliminate travel, and we're not going to eliminate agriculture, but how do we look at these industries and say, how do we take best efforts to reduce and mitigate pandemic risk, to prevent a future pandemic, and how do we make sure there's regulation in place so that we prepare for future pandemics as well? And I suppose that the last item, Mr. Speaker, that I want to close off with is there needs to be accountability in a particular role here. So, 1, it establishes a review, lessons learned. 2, the bill requires the Minister of Health, and I've gone into some detail. There's greater detail in the bill, but some detail about what ought to be in that plan. And again, I hope it can be a collaborative exercise at committee, because I do want this to be a nonpartisan exercise in getting it right. And 3, we need to make sure that we appoint a national pandemic prevention and preparedness coordinator to oversee and implement the plan, so there's proper accountability in an office for seeing this through. And lastly, and I just want to close out on this idea, because I think it is the relevant one. We forget crises in politics. We deal with them, and then we forget about them. And over time, we saw this with SARS. And we can't go through another situation where 20 years from now we look back at a debate like this one, or a pandemic prevention and preparedness plan that we've developed in the year 2022 or 2023, and it's been sitting on a shelf and it's not been updated and it's not been implemented. And so the idea here very much, as a matter of accountability, is to ensure that all future governments, regardless of political stripe, take this seriously and renew their focus on pandemic prevention and preparedness, and make sure that we don't lose sight of the lessons learned, and we don't live through, as a society, something like this ever again. Because again, the costs, and I can't overemphasize this, the costs of a pandemic, as we've just lived through, are so incredibly significant, and the costs of prevention and preparedness are a very, very small fraction of that. So I hope there's all party support for getting this to committee and improving the bill at committee, amending the bill at committee, and seeing it through, and I appreciate the time, Mr. Speaker.